the most important and pertinent information, whether it's, doing report or handoff or whatever it is. Your ability to walk into a room and know how someone is feeling, both emotionally and physically, and respond to that immediately.
Hello, this is Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians and Leadership podcast series, where we focus on empowering clinicians from bedside to boardroom. Today, we have the honor of being joined by Ms. Catherine Robison. Ms. Robison, thank you for joining us today. Do you mind taking a second to introduce yourself? Tell us a little bit about your experience and your current role and how you got to where you are today.
Absolutely. And Zach, thank you so much for having me on. I've been really looking forward to this conversation. And please go ahead and call me CJ. I have the worst name in the world to everyone in the world. It's Catherine Robison, no N in the middle, but I go by CJ. So I blame my husband for my challenging last name. So most important thing to know about me is I'm a nurse by background. I started out my career as a med-surg nurse at a healthcare system here in Southeastern Virginia. And pretty quickly moved into all things like nursing administration and process improvement. So I remember even like the second day as a nurse, I was like, why do I have to click so many buttons to transport the patient off the floor for a simple procedure? And that question landed me, chair of our partnership council, and then magnet program director, and nurse manager, and manager professional practice, and all those good things. But in the execution of that role, and I remember the minute I had enough, I realized that fundamentally, there are a lot of big challenges associated with delivering healthcare in America, and in general. But one of them is associated with the tools that we use. So I remember it was like midnight or 1 a.m., some middle of the night, we were on yet another staffing capacity management huddle, which we always had in January. And I was going to have to go in and staff my unit. And I had 3 little kids at the time, and my little baby girl was only a couple months old. I had gone back to work too early because I felt bad about leaving my hospital short-staffed. And as I went back to bed at middle of the night, knowing I wasn't going to have to wake up, she woke up and needed to be fed. And that's when I just was like, we need better tools to do our job in healthcare. And that ultimately is what led me to Oracle. So I joined Oracle a couple months before they acquired Cerner. I was on an innovation team, ended up leading a portion of that team. And it was a great experience, and I had, I will say when I made that transition from clinician to technology, I had all of the grand ambitions and aspirations. And what a cool title, right? Like to be an innovation scientist. And that work was really focused on, a really broad range of healthcare, everything from epidemiology to public health to life sciences. And I realized in that role, one, that my true love was all about like healthcare operations. I love figuring out how we can not just work more efficiently, but really the fundamental hypothesis of my career is that if we can quantify the work that we deliver in healthcare elegantly, that is going to allow us to make decisions about how we optimize and where we invest and how we support our patients in a much more targeted, nimble, granular way than we ever had. So now, and I know I'm being long-winded, Zach, so please forgive me, but now I am the Director of Healthcare Strategy on the North American Applications team at Oracle. And I know that that's a mouthful and nobody really knows what that means. Basically what I do and what applications really are focused on is looking at all of what we call the back office data. Everything from human capital management. So, things like career progression and onboarding and who's working where and when, all of this, we're doing some really cool stuff in advanced scheduling that I really love as a nurse, and stuff around finances, and I won't even get into I have no idea, honestly, how the finance department works, but I do know that I can get access to how much we're actually spending on things. And that's what I really like in supply chain. But where I get so excited, especially sitting in this place at this point in time, is I get to work with customers. I get to work with development teams and product teams on how do we combine all of this data in a way that really supports and drives all of the transformations in healthcare that we've been really longing for.
CJ, I love that story, and I think it's fascinating for a lot of reasons. But I think one of the ones that I find most fascinating is that that's not necessarily something that your current role is not something that when you started off as a nurse you set out to step into. Rather, you said and thought there's got to be better ways to solve these problems. There's got to be solutions that we can come up with. There's got to be ways to make things easier. And I think that is just the one of the fundamental reasons why we need people with that clinical experience that are serving in leadership positions, and part of the reasons why we have this podcast. And so I think that story is something that resonates with a lot of nurses, a lot of medical staff, a lot of people that serve clinically around the world and around this country, is recognizing that there are areas where their solutions and innovations need to happen, and because they are the ones that deal with it every single day and understand, they're like, man, these are a lot of hoops to jump through for this little thing. And so I think that story plus your background and experience is, I'm just really excited to talk to you today about all these things, CJ. And so I guess starting off, I'm curious, as we're diving into innovation, what role does leadership play in innovation, and how do you define success in your current role?
Yeah, those are two really great questions. I learned a lot about innovation and the efficacy of innovation in my prior role. So I'll share a few of those lessons learned. Um, I've been teased recently like that. I just have an inventor's mindset and an innovator's mindset. And here's the fundamental thing about innovation. Everyone wants to change the world. Everyone has good ideas on how to change the world. The trick isn't having the idea. The trick is figuring out how to scale the idea. And so, particularly in healthcare, like you go talk to any clinician, they're gonna know what they need to fix a lot of problems that folks in leadership probably don't even know exist. Like I remember this one time I was in a room and we were talking about like why folks weren't like scrubbing the hub effectively, and we were like, hey, the thing that you want, the cap that you want us to put on the central line isn't in the cleaning packet, and our leaders were insisting that the thing is in the cleaning packet. And then finally I just walked down the hall from the supply closet, opened the packet, and they were like, I was like, the cap isn't in there. And all that to say, like any clinician understands what the challenge is. The big challenge that we face in healthcare is articulating what the challenge is in a way that our leadership understands, measuring it so that our leaders care about investing to fix the challenge, and then embedding the solution into something that already exists so that we are not spending additional dollars for point solutions. Instead, we're taking the solution and we're elegantly embedding it into current processes. And so I'll give you an example of that, right? And I'll take it from my own career. So really early on, I knew like one of the big challenges in nursing is that our work isn't very well quantified. So like I get paid an hourly rate, but how that money is really being used in terms of how it's impacting like where I'm working, like that is we have no visibility into that. And so whenever you're making an argument for more staffing, it's really hard to draw the line between, hey, one, all these inefficiencies exist in my work. Two, I need more staff because we're falling short on this, and we're missing out on these outcomes, et cetera. Like it's really hard to draw like a really hard straight line so that someone who's never touched a patient, a CFO, etc., can understand the value of my work and therefore invest accordingly. So worked with the team, built a whole, what ultimately turned out to be a point solution, right? Where it was like basically a model that quantified the amount of time we spent with patients, and we could correlate it to how much money that was worth, right? But at the end of the day, it was just something that sat outside our system. And because it sat outside our system, required a lot of work, a lot of manual effort, etc. And so coming now over into Oracle, when I think about how I've defined success in this role, it is utilizing my knowledge of I won't even say what work looks like in a clinical setting, because I haven't touched a patient. The second you stop touching patients, right? Like you need to go talk to the people who are touching patients. So really my understanding of how to translate what folks who are doing the work need, understand what leaders who are non-clinicians need from a business perspective, and then an understanding of what technology is capable of, bringing all of those things together so that it is really easy to create tools that people love to use, but more importantly, generate the data that we can leverage from both a clinician and a leader perspective to really understand where we optimize healthcare to quote unquote change the world. And this is going to sound macabre, but I'm a nurse, so I get to be a little bit macabre, I think. One of the gifts of being a nurse is that I have been around death and I know what people say on their deathbed. And so I think a lot about like where I'm investing my time and what I want at the end of my life to be able to ruminate on. And so if at the end of my life, I can get to a point where we are able to understand how much we're investing per patient, per nurse, where we're able to have the challenges that I experienced as a nurse when it came to like even just the administrative burden of all of that. If we can create, like leverage the technology that already exists so that we can deliver joy back into healthcare, and we'll understand that like when we look at our 2-year nursing turnover rates, like if we can change that number of how many nurses are leaving the profession, if we can change the number associated with cost of care, that will feel like success. And I know that that's big and ambitious and it takes a whole world to accomplish those things, but now you know way more about my life story than you ever wanted to, Zach.
Well, I think you brought up some really interesting points, CJ, and I think one of the interesting things that you talked about is being able to put problems that your frontline clinical staff face using data to put that into the language that your executive suites
Mm-hmm.
understand. And it's not that, I mean, when you look at the healthcare systems, often you see clinical staff and then executives, and they have extensive experience. Both are very accomplished professionals who have extended experience both educationally, on vocationally, leadership, lots of fantastic individuals serving in both of those areas. But they're speaking different languages, and they've gone to school to speak those different languages, and their whole careers they've spoken those different languages. And so it sounds like data is the thing that can bridge the gap between those two. And so, just knowing that that's such a fundamental component of just operating a healthcare system, but also innovation. I mean, without data, no innovation can happen. And so, but as we look at this, a lot of these issues still persist. You mentioned staffing. You mentioned administrative burdens. There's burnout. There's a lot of these issues that are still plaguing healthcare systems. So it seems like that the data is often incomplete or lacking. And
Mm-hmm.
so why is that the case? Why do healthcare organizations often lack data necessary to
Mm.
be able to implement solutions and innovations that truly fix these issues?
Yeah, that is the billion-dollar question, isn't it, Zach?
Yes.
Yeah. I do have some thoughts associated with it, but I'm going to answer that first piece too, what you were just saying about vocabulary. So to all of, my friends out there who want to change the world and you've been delivering healthcare and you want to figure out how to do that. I got some really good advice from a friend of mine about a year ago when I was struggling with getting folks to care about what I cared about. And she said, CJ, you always talk in terms of improving patient outcomes. Like that is the value that we're trying to drive. And she's a businesswoman, right? And she said, I need to hear, how is this making money or how is this saving money? And that was like a light bulb moment for me. And it feels brutal. Like that feels brutal to change how our vocabulary from, well, I'll save X number of lives. But we all know if we save X number of lives, we're also going to save or generate X number of dollars. And so it's just taking that extra step to talk about, hey, if we do this, if we create this thing, not only is it going to improve the way that we schedule and therefore improve retention of nurses, but it will also save healthcare organizations up to $1 million a year, right? So it's taken that extra step to translate what I care about and what the business cares about, which is saving and making money. So your question was around, why is the data so messy? Why can we not get the data that we want? And there's That was fundamentally your question, right, Zach? Like, if data is the democratizing language that we use, why is it still so broken? I think there's a couple different reasons for that, and there are some really important ways in which clinicians are uniquely positioned to address this. One, you have different stakeholders who are analyzing the data and doing things with it, right? So, like in where I said, I work with sales, I work with product, I work with dev, I work with clinicians, and when I say clinicians, like delivering care, and I work with like C-suite leaders, right? All of those folks are looking at the data in a different way, and they have a different understanding of how that data is generated. So, there is a fundamental hypothesis that if something is in the chart, then it's true. You and I both know that's not necessarily true. Someone can write a note, someone can document incorrectly. Like we get all like the BP cuff doesn't fit and the reading is weird, so we do something different and we read again. Like we all know the data in healthcare is messy. It's very, very messy. You got discrete data over here, you have subjective data over here, you have notes. It's very complicated, and it takes a clinician to understand what is the data that you need in order to articulate what you're trying to get at versus not. Like what is valuable data and what isn't, right? Because not all data is made equal. Some is valuable and some is not. I don't need 10,000 heart rate readings to make when it comes to certain things that I'm trying to build associated with whether or not I'm doing a process analysis, etc. In other cases, I do need all 1,000 heart rate readings, right? It takes a clinician to understand that distinction. So that's one component. Two, in healthcare, we have a really fragmented platform ecosystem. And this is particularly challenging when you think about trying to leverage solutions like AI to improve things. And as clinicians, we might not be intimately and like have a deep understanding of what our technical ecosystem infrastructure architecture of our organization looks like, but it is worth thinking about and it is worth understanding. Every time you have an integration point, that is an area where you have a different data model that's going to need to be translated. And every time you have an integration point, it's one more spot where AI is going to become less efficient. And so where as folks think about how can I leverage data to drive the insights that I want to make my case, to understand where I can innovate, understanding what data is valuable, what data do you need that you do not have, what data do you have that you don't need, that's an important distinction. Then also really thinking through at the end of the day, are those like unique solutions, these point solutions that we leverage, are they really worth it to you? And so where I sit, I thankfully I get to work for Oracle, which has a huge tech platform, and our best innovations are coming from where we can combine EHR, EHM, and HCM and finance data to drive new insights. Where I can actually, at the end of the day, am going to be able to say things like, "Hey, you're investing this many dollars on these processes, and this is the impact it's having on your patient outcomes and ultimately your bottom dollar. Do you want to clean up some of those processes to make things easier?" And so that is what I would say associated with why is the data so fragmented. A lot of stakeholders, folks that don't understand the data intimately, they don't understand how to use all of the different data. And at the end of the day, what you really need is someone who understands all of the different ways that data is being generated so that you can articulate a vision of how we can clean that up.
Well, and CJ, I also loved how you just emphasized the importance of a clinician doing that role, because
Mm-hmm.
not only are they, best equipped to step into that role, but also they have that patient centered perspective because
Mm-hmm.
they've provided care to those patients, and that's really the goal of healthcare and healthcare organizations, is to improve patient outcomes and provide healthcare to those patients. And I think those are really interesting things you bring up, particularly, I mean, just thinking about the innovation over the last couple of years with artificial intelligence platforms becoming more prominent, and a lot of individuals viewing that as kind of this is going to fix healthcare and it's going to solve so many things. But fundamentally, if you're dealing with broken data and siloed data and fragmented data, that is the same data that AI is going to be dealing with as well. And so, if anything, it sounds like it is just going to mask over problems and be potentially maybe help a little bit, but not see the true success that we're hoping and kind of counting on it being. And so I guess my next question is you've identified like why it's fragmented. How do we make it less fragmented? What can we do? Is there anything that can be done, or is this just the way healthcare is?
Oh, I refuse to believe that this is just the way that healthcare is. I'm an idealist at heart, and I believe that we're going to change. Um, so I've been really great. I have friends who say brilliant things, and you guys have probably all heard this, but I think that the first step to addressing our fragmented data ecosystem and therefore fragmented healthcare system is to begin with the end in mind. So, yep, the data is super messy. The platforms are messy. The way we deliver healthcare is messy. And a lot of that is because we just keep layering processes upon processes. Something breaks over here, so we put something in place over here. We don't understand how it has an impact somewhere else, right? So, I challenge all of you, like, as you think about whatever is like your passion project, the thing that you want to fix, whatever it is, to not stop at like that first, like, if we just do this, then we'll fix it, but to really think deeply about what is the fundamental thing that we need to understand why this exists. So an example for me, I'll go back to that initial assessment, right? We do not understand at scale the granular work that people do, right? So when we talk about inefficiency, what is that but compounded tiny moments of inefficiency in healthcare, right? I'm not stocked on my supplies, like my, whatever like stupid thing it is, like I can't, the bladder scanner's on a different unit, whatever it is, like people, like we do not understand at a really, really low level how people work and the cost and value of that work. Now, don't judge me. I read Elon Musk's biography by Walter Isaacson. And whatever you think about Elon Musk, like his approach to driving efficiency in an organization is interesting. And I'll be honest, I read it like 3 years ago before all of the different things, right? So take all this with a grain of salt. But in that book, it talks about like his approach is to understand the cost of every single nut and bolt that goes into his cars, right? To understand really deeply, like the entire supply chain associated with like a single, whatever, like thing that goes in the car for everything. And in healthcare, we have no way to do that. We have no way to understand at a like really deep level, aside from chasing people around with timers and all this stuff, the work that we do. And so when you're thinking about how do I fix this broken data ecosystem, it begins with what, like that fundamental, really deep level of why does the problem exist? Can I measure why the problem exists? And the first step in MET is to get to an effective way to measure why the problem exists. And once you're able to measure that, then all of the other solutions just cascade from that. It's not easy. It's a lifetime of work. But until you have an accurate assessment of why does this exist? What is actually happening? Nothing else. That the solution will continue to be convoluted and cause challenges in other areas, right? And I stand by that. I think I stand by that. I'm sure we'll get some comments around, nope, you're wrong, and this is why. But I stand by that for really anything, but particularly in any of the challenges we face in healthcare.
Well, and CJ, I think one of the most fascinating things about that is often when we talk about problems of inefficiency or just issues that healthcare organizations face, they're looking at large scale issues like
Mhm.
how is this affecting the whole unit, how is this affecting the floor, how is this affecting the hospital, how,
Yeah.
how is this affecting the group of nurses, all of that, when in reality, I think one of the most effective things that you just said is looking at the simple little inefficiencies that build up, and I think that that's something that leaders throughout healthcare and nurses and clinical staff can do and look at and see like, hey, what are the little parts about my day to day life that I have to do every single day that end up taking time away from seeing patients, taking care of patients,
Mhm.
doing things that are supportive and need to be done. Stocking your rooms, those rooms have to be stocked because you never know when you're going to need a particular supply. But that inefficiency of having to take that extra time to do it builds, and I think that is such a key actionable thing that leaders, whether that's managers, directors across the country can do is by looking at their units, looking at their programs, and seeing where those little inefficiencies are, and asking those nurses. I think that's such a critical thing too. Like your background coming from being
Mhm.
one of those nurses, it's like, man, this is really inefficient. This is really, there's a lot of hoops, there's a lot of buttons to click. I think that's such an actionable, helpful thing to keep in mind, is that change to make it big, it's got to start small, and you gotta, or else that big change may happen, but it's not sustainable. And so I think
Mhm.
that's fascinating, and loved the way you did that. And so TJ, I before I let you go, just one last question before I let you go. Thank you for your time today. But for I'm just kind of a general broad question, but for nurses that maybe were in your shoes when you started out that career, that are experiencing those same, having to click all those buttons, that are experiencing that frustration and lack of innovation in ways. People that recognize issues within their workplace, and want to make a change, but maybe don't know how.
Mhm.
What advice would you give to them on how to start the process of making improvements where they're at? Because they're the experts on what needs to improve. Maybe not necessarily how to improve it, but what needs to improve. So what advice
Mhm.
would you give to those people?
Yeah. Um, the first thing is, and I'll kind of expand this to any clinician out there, we have a unique skill set that many people do not have, right? Your ability to communicate effectively over a short amount of time, the most important and pertinent information, whether it's, doing report or handoff or whatever it is. Your ability to walk into a room and know how someone is feeling, both emotionally and physically, and respond to that immediately. That's a unique skill that is translatable over into any setting. Your ability to assess a situation using limited amount of information and make a decision to act that's going to have an impact. That is a unique skill set. Your ability to get stuff done in a convoluted and complicated system in which everyone is exhausted and lives are at stake, and do it over and over and over and over again. That is unique. That skill set is the powerhouse behind the change that you want to make. So, first, I would just say don't get tired. Like, you are tired. Let me rephrase. Don't lose sight of the fact that you are uniquely skilled and gifted to drive the change that you want. Two, all of the things that I've said about understanding the business side of the house, that is that is an addition to your superpower if you're able to translate what needs to happen and frame it in terms of business, so that people who have never touched a clinician, who have no idea what your life is like, but that they can understand in 3 sentences the value of what you're articulating. I would invest in skills that drive that. Three, technology is going to change the way that we deliver care. We need to be the ones that are directing and driving and defining how care is delivered, both in terms of the clinical setting, what it's doing for our patients outside of, the four walls of the hospital, down to how it's assessing how we're working and where our leaders are going to invest from a strategic perspective. And so it's important to educate yourself on the different tech available. What are the data structures? What's the difference between AI and agentic AI and machine learning? What are the implications of those things? Where should we be investing first? How should we be thinking about how our care is quantified? Should we be pursuing a staffing ratio model? Should we be pursuing a workload model? Like, have an opinion on those things, watch them carefully, think about those things, and then being able to balance who you are as a clinician, who you are as an innovator, and who you are as a business leader, bringing all of those things together. That's how you change the world.
Well, CJ, thank you so much for joining us today on the Clinicians and Leadership Podcast. We're grateful for the work that you're doing and the impact you're making, not just on healthcare organizations, but in patients' lives through your work and your innovation and your leadership. And so it's just encouraging to hear your heart and passion on this topic, and just to be reminded that change starts small, and that there are things that we can do that will make a positive impact and will make a change. And that is something that is just very encouraging, that sometimes we can get discouraged when we are facing these things. So thank you for sharing with us today your insights and experience, and we wish you the best going forward.
Thank you so much, Zach. Always a delight to talk with you, my friend.